In a moment, we'll hear from the Health Secretary, Matt Hancock. First, though, to a listener to this programme who contacted us yesterday. 97-year-old Elizabeth Diacon is a veteran of Bletchley Park and is now living in a care home in Wiltshire, which, thankfully, so far, has no cases of the virus. But she and others in it are already feeling the effects of it.
It's put a lot more pressure on the staff. They were called unskilled carers, but a couple of weeks ago they were promoted to being key workers, but I don't think they get many privileges.
You think they're not really treated as key workers?
No, I don't.
Or
I
indeed
don't think
paid like them?
they're not paid enough. They are really being worked off their feet. I can't speak highly enough of them. They have just received their PPE, and of course they're doing all they can to wipe everything down with disinfectant. The question of sort of isolation doesn't apply because most of the key workers here are hands-on carers 24 hours a day, I mean in shifts. But there's no way of doing anything 6 feet away. They're taking all the precautions they can, but if they did bring an infection in here, it would just go like wildfire and everybody would get it.
A rather terrifying thought.
Yes, and because you don't come into a care home unless you need pretty full care, and you are dependent on your life, really, on your carers, because if they all went sick and the cook went sick, everybody would be dead very quickly.
And how does that make you and other residents feel? Is it an anxious time at the care home, even though so far as you know, as I understand it, there isn't a case at your home?
Well, I would say perhaps 60% have some form of senile dementia and are not really aware of anything except that their families are not allowed to visit them, and they think they've been deserted by their families, and they don't understand for what reason.
Now, a manager at the home asked you to sign a letter recently.
Yes.
Saying what?
Well, it just said, I think we all had to, all of us who could, just to say that if we felt ill, we would not go to hospital, unless, of course, we broke a hip or something.
But as blunt as that, if you get the virus in particular, you would not get hospital treatment?
Well, I presume that's what it meant. I don't know where the form came from, but I've spoken to several of my friends in care homes, and they've all had to sign it. I didn't know whether it came from the local surgery or whether it came from a government source.
When you say had to sign it, were you put under pressure?
Well, you didn't have to. You were asked if you would sign it to agree. And I thought I would rather be ill here than go to hospital. Our local hospital is much overworked and it has the virus there. I'm not afraid of dying, but I'm rather afraid of how I might die. But I'd rather do it here than go to hospital.
Did you feel pressured?
No, not at all. That I would like to know where it came from and who authorised it.
And the Health Secretary will be listening to you. What would you like to ask him or tell him?
I couldn't say we've been abandoned by the care home, but I think possibly some of the government have been a bit slow.
Do you think the lives of elderly people have been properly valued in this crisis?
I think they have put the residents and the people who are in charge of care homes a bit on the back burner.
Elizabeth Diacon talking to me earlier. Let's turn now to the Health Secretary who joins us on the line, Matt Hancock. Morning to you.
Good morning.
Can we begin with what Elizabeth was saying? Let's begin with the specific first of all before we turn to the general situation in care homes. Should she get a letter? Should other residents of care homes now be being asked to promise that they will not ask for hospital care if they're seriously ill?
Well, this is a very sensitive area, and has always been the case that the people are asked for their wishes in the terrible instances in which they might get very ill, especially towards the end of their lives. So It is exactly as Elizabeth said. It is a standard procedure that has happened for a long time.
What's not standard, though, Secretary of State, is for everybody in a care home to be asked all at the same time, all around the country, please sign this letter. Now, is that just inevitable because of the virus, or is it inappropriate?
It isn't inappropriate so long as the decision is made on an individual basis according to the clinical needs of that person and their wishes. And exactly as Elizabeth said, she isn't pressured. To be pressured would be completely inappropriate. And the idea of a blanket decision is completely wrong, but it is reasonable and right, in fact. And I'd argue that it's a good thing to ask people their wishes in these difficult circumstances. And as you heard Elizabeth say, her preference would be to stay at the care home, and that's often the case. And we should take those sorts of preferences into account.
Let's turn to the other things that she said, if we could. Now, it was a classic bit of British understatement, wasn't it? The government have been a bit slow. We and the staff have been put on the back burner. When you returned to work after the virus, you said you wanted to level with people. Is it time to level with people on the care home situation and say, look, they haven't been protected as well as I would have wanted. A lot more now needs to be done.
Well, it's absolutely true that we need to do more. That's why we have yesterday put this next stages of our action plan out, and in particular, as we expand testing, so we can now test all people going from hospital into care homes. I think that it is true that we put out the first guidance for care homes back at the end of February. I mean, you know, one of my first conversations with Chris Whitty, the chief medical officer, about this disease was that one of the first things we found out about it was that it has more of an impact on the older that you get. And that immediately brings to mind the fact that care homes are going to be particularly vulnerable.
And yet at the same time, Mr. Hancock, at the same time, just put this point to you if I could, there was official advice coming from Public Health England in February, quotes, it remains very unlikely that people receiving care in a care home or the community will become infected. That wasn't just nonsense, it was dangerous nonsense, wasn't it?
No. That was absolutely true at that time, because at that point the rate of transmission in the community was very low, and hence we've strengthened the guidance as we've gone through this. So you've got to follow the evidence at each point in the spread of the epidemic, and hence expanding testing now.
Just before we get to testing, if we will, I do want to give you the chance to talk through that. But the other thing that worries people is that the figures, maybe for good statistical reasons, but the figures massively understate the scale of the problem that there is in care homes. They're collected in a different way. They're not shown on the graphs that we see day in, day out. Now, one chain has told us 2/3 of their homes have coronavirus. Another said half of their homes have coronavirus. The Scottish First Minister said 4 in 10 homes in Scotland have the coronavirus. And yet, I think I'm right that the latest figures from the Office for National Statistics suggest only 5% of coronavirus cases are in care homes. They're simply out of date or plain wrong, aren't they?
I don't think so. That's not quite what the statistics show. The 5% figure is the percent of people who receive care, social care, which is both care homes and domiciliary care, who die at home as opposed to in hospital. What that shows is that most people who receive care do go to hospital. In fact, the vast majority to receive that support for, to receive the care if they've got serious COVID. But you make a broader point about the statistics, which is right and reasonable, which is that we do collect the statistics in a different way because of the way that care operates.
So do those numbers that I put to you, sort of 2/3 of homes in one chamber, half in another, 4 in 10 in Scotland, do you think that's roughly right? You can't know for sure because you haven't done your testing yet, but it's roughly right to say half or more of care homes have got a coronavirus outbreak.
No, both of those points I'm afraid I just need to correct slightly. The first thing is we are testing in care homes. We have been since the start of this. and we test. The thing that we do is, what we have done is tested all cases until up to 5 cases in a home, and now we're going to test all cases in a home. So we know where the outbreaks are. That's one of the things we do know. An outbreak is defined as 2 or more cases
so
in a home.
How many homes are you saying have got it? If you're saying I'm wrong to say it's half or more.
It's 15% have 2 or more cases.
But that doesn't sound right, given what the chains are saying, given what the Scottish First Minister's saying. Are you really confident it's as low as that?
Well, what I do know is that is a robust figure that we have high confidence in.